Hey, my name is Brittany Bridwell, and I'm here to present a case study for my Nursing 8210 class. My patient is a 19-year-old female who presented to the ED with a complaint of sore throat, chills, body aches, fever of 100 to 102, nausea, and bilateral ear pain that started 3 days ago. The patient has no past medical history, no surgical history, she's a non-smoker, she does not drink, and she does not use street drugs. She's not allergic to any medications. She has no medications that are prescribed to her, but she has been taking Tylenol and Motrin at home as needed for fever. For my review of systems, she's healthy appearing, alert and oriented ×3, and normally nourished, and in no acute distress. For weight, she denies any recent significant weight changes. For skin, she denies any rashes, lumps, bruising, bleeding, skin color changes, but does complain of intermittent fever, chills, and body aches. My patient denies visual problems, hearing problems. She does complain of bilateral ear pain. She denies drainage from her ears. She denies a recent cold. She does complain of sore throat, but denies nosebleeds or any dental caries. For cardiac, she denies cyanosis, shortness of breath, any previous heart murmurs. For respiratory, she denies a history of pneumonia, wheezing, cough, or coughing up any blood. For GI, she denies abdominal stool color change, denies diarrhea, she denies constipation. She does complain of some nausea but no vomiting. For GU, she denies any urinary complaints, any frequency, discharge, any pelvic pain, or polyuria, and denies previous urinary tract infections. For musculoskeletal, she denies joint pain, swelling, fever in the joints, or any obvious deformities. For neuro, she's able to move all extremities. She denies headaches, denies any motor deficits, and denies any neuro complaints. For allergies, she denies a history of asthma or any previous drug reactions, and denies itching. My patient's vital signs: blood pressure is 97/65, heart rate is 79, respiration is 18, her O2 sat's 100% on room air, and her temp is 97.8 oral. For my physical exam, her skin is warm, pink, and dry with no rashes, bruises, or lesions. She has good skin turgor, no adenopathy, and no fever present on exam. Her head is normal cephalic and atraumatic. Her eyes, her visual acuity is intact. Conjunctiva is clear. Sclera is clear. She has a normal external ocular eye movement. Red light is present bilaterally. Corneal light reflex is present. Pupils are equal and round and reactive. And there's no evidence of strabismus and no evidence of redness or swelling to the eyes. The ears, the tympanic membrane is opaque and mobile. Hearing is intact. Ears are symmetrical and ears are patent. For nose, nares are clear, no redness or irritation noted, no tenderness, polyps noted, or any discharge from the nose. Mouth and throat, mucous membranes are moist, no mucosal lesions. She has an intact palate. She does have an injected oral mucosa, oropharyngeal exudate, and posterior oropharyngeal exudate is present. For her neck, she has good tone, no adenopathy or masses. She has full range of motion and normal presence of the thyroid. For her heart, no cardiomegaly, no thrills. She has a regular heart rate and rhythm. No gallop, pulses are present and palpable. No cyanosis, no clubbing, a normal heart rate and normal rhythm. And brachial pulses 2+ bilaterally. For respiratory, respirations are equal and unlabored. She has the equal rise and fall of the chest. Lungs are clear to auscultation. For abdomen, bowel sounds are present and normal. No tenderness, masses, or hernia noted on palpation. And she has normal contour and symmetry of the abdomen. For neurologic, she is alert and oriented ×3, and no deficits are noted. For diagnostics, we performed a rapid strep test, which was positive. Her diagnosis was pharyngitis. For differential diagnosis, we have a viral infection, mono, or a peritonsillar abscess. We are prescribing her amoxicillin 500 milligrams PO BID for 10 days. For education, we told the patient to drink plenty of fluids, take an entire course of antibiotics, use Tylenol and Motrin for fever, and return with any increased fever or concerns. My ICD-10 code for this patient is J02.0, and that's for streptococcal pharyngitis. Thanks.